Hi, I'm Dr. Eric Chow. I'm the Chief of Communicable Disease Epidemiology and Immunizations here at Public Health Seattle King County. I'm a pediatrician, I'm an internal medicine doctor, and I'm also an infectious disease subspecialist. I'm here today to answer your questions about COVID-19. So COVID-19 continues to circulate in our communities, causing infections, hospitalizations, and deaths. In fact, we're continuing to see fluctuations that change from week to week. And we at Public Health Seattle King County continue to track these numbers over time. And although we're not seeing the same degree of infections that we once did at the surge points at various points during the pandemic, we're still seeing a high number of hospitalizations and death, especially among those people aged 65 years and older.
tiradu hadda waa sidee marka loo fiiriyo dabayaaqadii sanadkii hore ee COVID, RSV iyo hargabku aad u sareeyeen.
Yeah, the last time we spoke, there was a lot of concern, especially among the Somali community, about the tridemic, where we saw a surge in respiratory syncytial virus or RSV infections, early increases in influenza cases, and ongoing circulation of COVID-19. And the combined effects of these respiratory viruses put a lot of stress on our healthcare system. Fortunately, since the beginning of 2023, we saw decreases in the number of cases of RSV infections as well as influenza, but we know that COVID-19 continues to circulate. It's important to remember that our healthcare system remains at capacity, and even small increases in infections can really strain their ability to provide care to people in their clinics and hospitals. This is why it's so important for all of us to take steps to make sure that we provide protection against infection and severe disease. And for COVID-19, this includes staying up to date with the recommended COVID-19 vaccinations, including the updated bivalent booster. And other ways in which you can prevent infection include wearing a well-fitting, high-quality mask, especially when you're indoors and unable to social distance from other people. And it's also important that if you have any COVID-19 symptoms, that you should isolate and stay away from other people.
Ma jiraan noocyo cusub ee COVID-19 oo hadda laga walaacsan yahay. Hadday haa tahay, maxaan u baahannahay inaan ka ogaano?
COVID-19 variants such as XBB.1.5 have caused a lot of concern because COVID-19 variants have been responsible for previous surges during the pandemic. Now, XBB.1.5 continues to become increasingly common in certain regions of the United States, and we at Public Health continue to track this variant as well as others as they circulate in our communities. The good thing is that our current vaccination remains very effective against severe disease, and the best way to protect yourself and your loved ones from infection and severe disease is to stay up to date with the recommended COVID-19 vaccinations, including the updated bivalent booster.
Haddii aan horey u qaadanay tallaalka COVID, ma u baahannahay inaan qaadanno kuwa dheeri ah?
So we've learned a lot about COVID-19 during the pandemic, and we know that our vaccine is very effective at preventing against severe disease. However, we also know that the virus can change or mutate over time, and sometimes it's also important to provide our immune system a little bit of a reminder on how to fight off infection. And this is why the CDC recommends staying up to date with the recommended COVID-19 vaccinations, which includes the updated bivalent booster, which has been available since September 2022. Now, even if you've received a booster prior to September, it is still important to provide the best protection against severe disease is to stay up to date by also getting the updated bivalent booster.
Carruurta iyo dhallaanka yaryar ma qaadan karaan tallaalka COVID?
So we know that COVID-19 remains a serious public health threat and actually can cause severe disease in people of all ages. We also know that the COVID-19 vaccine can provide very good protection, and this is why we recommend staying up to date with the recommended COVID-19 vaccines. COVID-19 vaccines currently are available for all individuals 6 months and older. We know that adults and children who are unvaccinated have a higher risk of hospitalization and deaths due to COVID-19 than those people who are vaccinated and up to date. And we know that currently there are no vaccines for the youngest age group. However, this is why it's so important that pregnant women and other people who come in contact with the youngest age group who are not yet eligible for the vaccine stay up to date with the recommended COVID-19 vaccinations. This is also why it's so important that individuals who are symptomatic or have symptoms of COVID-19 stay away from those youngest age groups who are not yet eligible for the vaccine. I know that there's been a lot of concern that's ongoing about COVID-19 impacts in certain communities, including the Somali community, and I appreciate this opportunity to speak to the Somali community about the importance of staying up to date with the recommended COVID-19 vaccinations. We know that these vaccines are safe and can provide great protection against severe disease. So anyone who is not yet vaccinated or not yet boosted, now is the time to get your vaccination.
Thank you, Jared.
Oh, it's always a pleasure, Abdi.